women.
Unity Point Health says it may pull out of an agreement with Amerigroup by the end of this year. The decision would leave nearly 54,000 Iowans without a doctor. Amerigroup will be one of two remaining Medicaid providers in 2018. Right now, both companies are negotiating a new contract. If no deal is reached, Unity Point Health hospitals would no longer be in the Amerigroup network. There are 4 of those hospitals in the CBS 2 viewing area, including St. Luke's in Cedar Rapids. Roughly a third of all hospital patients in Iowa are treated in rural facilities. And while hospitals everywhere are working hard to navigate through the changing healthcare landscape, those outside of our urban centers are facing additional pressures.
Our wedding pictures, obviously, in Okoboji.
Nicole Denler moved to Belmond, Iowa 7 years ago and developed a family within the community of 2,500 people.
That patient's mine.
She's a nurse practitioner at the local hospital, where she also gave birth to her 10-month-old son, Bo. What would happen if the hospital closed?
It would be devastating for me for this.
Personally. What do you think it would mean for the community as a whole?
I think the community as a whole, it would crumble.
The hospital is one of Belmont's 3 largest employers and is an economic engine for the city. It came dangerously close to shutting down several years ago.
The average daily census for Belmont was 0.8, so not even 1 patient per day was what we had in the hospital, which is not sustainable. Obviously, if you don't have patients in your hospital, you're going to struggle paying the bills. So we actually have a 1-bed ICU.
With just 22 beds, Belmont is a critical access hospital with a very slim profit margin of between 2 and 3%. Nearly half its patients are on Medicare, and like other hospitals, Belmont has no control over reimbursements.
The population of Wright County is typically elderly. We have a lot of Medicare patients, and so sometimes that's hard to then make up the difference with your commercial payers, and they're even tightening their strings.
Polzin says the hospital makes up some of the difference through grants, but ever since Iowa switched to a privately run Medicaid system of managed care organizations, it's been a struggle.
I think we just moved too quickly. Not everybody was ready, and that has delayed payments for many. And we're still fighting those battles.
Medicaid, the MCOs, the Medicaid managed care within Iowa, not paying like they did before, that hurts. That hurts a lot. And with everybody's deductibles going up, we're also seeing a lot more self-pay or a lot more bad debt in our rural communities.
The mayor of Belmont has another concern in the back of his mind. Al Madison says the hospital gets no property tax support from Wright County because the city owns it. And that means an additional liability.
They're not on the books, they're not on the city's books as long as everything's going well. But if it starts to fail, the city takes it over, and now we're going to tax the people to keep it running, just so locally. That's going to be a huge impact.
Fortunately, the financial cure came in the form of a partnership in 2007. That's when Wright Medical Center, another small hospital just 15 miles away in Clarion, started collaborating with Belmont instead of competing.
When we sat down and we talked to them the first couple of months, we said, we've got to figure out something to make this hospital shine on its own.
6 years later, through construction and strategic planning, Wright Medical Center and Belmont Medical Center became Iowa specialty hospitals, finding their respective niches in the market. Bariatric surgery is now the main service line in Belmont, with orthopedics and OBGYN the drivers in Clarion. The award-winning hospitals share staff and providers as another way to save money. And just this year,
the patients are talking to the doc.
Added telemedicine in partnership with UIHC.
So the quality is deep.
I don't think there's anything more incredible than that for our patients. Like, you get to stay close to home, you get the exceptional care that you expect, but you get all of the specialists of the University of Iowa at your disposal.
Everyone I talked with in Belmont and Clarion are proud of what Iowa specialty hospitals have become.
We save lives, and I don't know if those lives we have saved would have been saved if this facility wasn't here.
But the healthcare road ahead is still scary for many.
We can breathe easier knowing that we have an excellent facility to get treated at, but can I pay for it?
80 rural hospitals have closed their doors across the country in just the last 7 years. None in Iowa, but more than 30 in this state have negative profit margins. That could get worse depending on what happens in